Thanks for staying with us. Part of what we began the program with this morning was talking about that young lady that plunged, herself into the lagoon for one reason or the other. And in these days when so many people are having all kinds of health challenges, some they can explain, some they can't explain. Stress levels are rising every day.
And we hear that there is good stress.
We hear there is good stress, there is bad stress. In fact, there's stress, there is extreme stress,
there's huge stress,
there's chronic stress, and they say that stress is not bad. I don't know, but we're not getting into that today because I can't even deal. But today, let's talk about, because at the end of the day, when we were having a conversation with our guest 2 days ago, one of the things that she said was, look, at the end of the day, everything goes to the heart. So let's talk about heart health. And Yonda Agbeniga joins us this morning. She's Principal Consultant of Medi-Ideas Lifestyle and Wellness Center. Thanks for joining us this morning.
Good morning. Thank you very much.
You know people are having issues. I don't need to tell you. You're probably having yours as well. That's why. But so we're not. No one is immune from the issues that we have to deal with on a daily basis. But here we are, heart health, and what are some of those things that people are not aware of? How do we, if I can use the word, wound our hearts without even knowing that that's what we're doing?
All right. The starting point on heart health is that we should always remember that the heart is a muscle. And like every muscle, if it is not exercised or used or constantly kind of put under some form of pressure, it will develop a lot of problems. So most times people think that exercising is only to lose weight. That's the first place I'm going to start this morning. Exercising is not only to lose weight, it is to ensure that your heart keeps pumping. And that muscle is the muscle that the harder it works, the better it is. So that's why you have your cardio, you're going on your treadmill, you're doing brisk walking, you're jogging. The more you work out, the more you keep that heart active, the better it is. So that's the first thing for heart health. And we need to come up that mindset that the only reason why we exercise or we're active and we're not sedentary is because we want to lose weight. And that is one of the fringe benefits of exercising, and that is one of the fringe benefits of keeping healthy. That's one of the fringe benefits of losing weight, because you need that heart to work.
But so that's on the one hand, people assuming that they go to the gym or they exercise only to lose weight, but then unconsciously they are also working on their hearts and making their hearts function better. But then we also know, I was shocked one day when my coach told me that there was a day they started exercising one man, fairly young, giving him some exercise regimens. They were just doing what they call the stretch, and the man collapsed. Why are you laughing?
Of course, I know what pathology has gone wrong.
Oh, really? What happened?
It's understandable. Okay, so another thing that happens with heart health is that it's just like the kidneys until about 80% of the kidneys pack up before you know that, hey, there's trouble. So there's so many conditions that could have gone wrong with the heart. Some people call it ischemia, some people call it ischemia. There is angina, in which you just feel that look, that's such a bad signal. It's a terrible signal when your heart just locks up and you go, oh, that's because one portion of the heart did not get oxygen, and that's a reaction. So there are so many things that could have been wrong with him, and there was no signal, no visible signal. I once had a lady walk into the center, and she came for diverse things. And pronto, we looked at the BP. It was 230 something. And she was like, oh, I walked in myself. I'm like, yes, we're going to keep you there and give you one or two things before to get that BP drop.
How did you walk in?
Yeah, that's it. So there are people like that who are not even aware that a lot of things are wrong because they feel there's no signal or there's no symptom, but really the body is already stressed out. So if that person that had ischemia goes on the treadmill or ischemia, like some people call it, that's some portion of the heart not getting oxygen. Reason, because that portion is not receiving blood supply. And you know it's the blood that carries oxygen. So he would knock out.
He hadn't even gotten on the treadmill.
That's it.
He was just stretching. You know, before you begin exercises, you first of all do some stretches, get your body ready for the thing. Now that level you do.
Now, two other things can contribute. One is either he's very fat and he's having plaque. You know that thing they call cholesterol, bad cholesterol, building up in the arteries. Now the artery is, let's say this is the pathway, the passage for blood flow, and then there's cholesterol, calcium, all sorts building up. The space for blood flow is reduced, and that blood flow is carrying oxygen and nutrients, and so it's reduced, and the blood pressure from the heart is still constant. The heart is still pumping. It's not going to stop pumping, but between the pumping area and the end point where that blood is needed, there's a blockage. So you now put so much pressure on him, there's so much pressure from the heart pumping, and there's a blockage, and that place didn't get oxygen, he knocks out.
How do people know that they need to pay attention to, because just as you're saying now that there'll be no signs.
Yeah.
Sometimes there are no signs, but there's some signs that you know. When you come in, permit me to say, to the center, the very first thing we will do is take your BP, and then we take some vitals. We call it our own our center's vitals. We do waist circumference for men because we want to see how your propensity to cardiac issues. Now, if you see a man with a big bulge, let me use the classic example. Now, like, with all due respect to the guys at the park, okay, they're very happy to have this big bulge in front of them, and they're like,
that's very African.
Yeah, like we have arrived, you know.
I am healthy and well.
Yeah,
fed.
And I'm going somewhere. So we have arrived. I don't need to run a scan. I don't need to run a check. I know that he's diabetic and he has high blood pressure. That it's a given. So the bulge, you see,
just
that fat,
yes, belly.
That bulge, the fat deposit in the belly area, especially for men, that fat deposit there is also inside the arteries. Arteries are blood vessels, and so you'll find reduced passage of oxygen and nutrients and blood flow supply to some portion of the heart or some portion of the body. It could trigger a stroke if that blood flow to the brain and oxygen flow to the brain is cut off. If that plaque keeps growing bigger, it could trigger. That is when you have that, oh, I can't breathe portion, you know, and then, you know, that's a warning sign. You just have that, oh, and then you hold it down, and then it goes off. Yeah, that's a warning sign that danger is ahead. It could ultimately lead to maybe a stroke or the partial stroke or whatever. And then another thing, now for the women, now necessarily having a big bulge in front might not be fat deposits. We know some women who's had CS, some people whose uterus did not go back after delivery. And so, but there's a certain number that we would check, visceral fat and all that. There's a range for that reading for women. Then constant loss of breath, people who are speaking, and there's so much palpitation. You know, there's a lot of problem with breathing, and then sometimes there's something called chronic tiredness syndrome, when the heart is not getting enough oxygen, you're just getting tired. Some form of anemia and all that could signify that something is wrong, you know, with the heart. But the best way to know is, like I say, go for a check. You know, there's specific numbers that you would know, and there's some kind of diets that predispose you to ischemia or ischemic heart attack and heart problems. Another thing that could trigger it is cortisol. Cortisol is obtained from stress. Now, the moment I say it, like in physics, there's every equal and opposite reaction. You know, for these, you get a response. For stress, not you stress, the good stress, no. For Stress.
Good stress.
Adrenaline release, you're just releasing cortisol. Anger, all those things, you're releasing them. And adrenaline from anger is supposed to come in, and it's a hormone that should be in your body. It's a fight or flee hormone. It's not supposed to be sustained long term. So you have it sustained long term in the body, it's causing damage to the heart muscle and to other muscles. Cortisol, extra stress, extreme stress. Traffic on some part of the road.
Just say your road.
So there's release of cortisol. So for that, of course, I have my way of knocking that out. I just go under infrared for a long time. I detoxify, or I just do some terahertz therapy, run frequency over my body, and I just clean off all that cortisol. So there are a lot of things that we're using, having around us, eating and participating in, that is creating.
We'll come to the nutrition part, of this conversation.
Yes. Now, let's talk about blood pressure. Okay. Because as one gets older, they tell you check your blood pressure regularly. It could be a cause for heart disease and God knows a number of other things. Talk to us about blood pressure. What is a healthy blood pressure? When should we begin to worry? At what reading should we begin to worry and go and seek medical help?
If someone who has 239 can walk into your shop.
Okay, well, basically, I would just give an average. Now, that is not cut in stone, but between 120, 80, that's fine. But the truth is, if you check, I'm not very sure because I don't want to quote. If you check, I think CDC page and some pages on Wikipedia, I think the ranges are being gradually increased because it's a prevalent condition. So you see people with 122, 123, 124, and when we see people like that, if they are in their maybe late 50s and co, we're like, oh, that's still fine. But once you start saying a 180, 150, you know that, yeah, that's bad. And then when the pulse, that's the number of beats per second, goes to 100. Now, that's a real, will I say trigger point or alarm point?
Goes to 100 at rest period.
Yes, at rest period. Oh, yeah, at rest period.
52.
That's great.
Thank you.
So you just received diagnosis now?
Yeah, 52 as pulse.
Yeah. Well, it's gone to 56.
No, your pulse.
Now you've made me scared, so it's gone to 56.
No, your pulse should be 60.
58. You're making it
60,
rise.
60 is okay. Sorry, 60 is okay.
You're making it rise.
I wasn't going to say that.
You scared me.
No, 60 is just perfect. It should actually not go below that, but 60 is okay. And then you're resting, you're sitting down, you're not...
And I've been sitting down for almost 3 hours.
Yeah, so I mean, that's still fine.
Okay, now...
Okay,
go.
Now, you have not told us where we should start getting worried.
Yeah, from
from
I
130.
said, yes, and above.
But
especially,
don't you doctors say that the lower one is the more important one?
For me, now that's for me, once I start seeing the word on top jumping, I know that there's a lot of problem already. And then sometimes there's some biochemical markers I see when we're scanning, and maybe I see angiotensin. Once I start seeing those markers, maybe I see my troponin and all that. There's some markers that I see in the blood works that I know that, oh, there are no signals, but this is a potential condition. Once those markers are high, maybe CPK, there are some markers like that. The people in the diagnostics will understand. Once I see those markers, I know there's a problem somewhere. Maybe the heart lining has issues, or maybe there's a blockage, or there's a propensity to a stroke. Yeah, there's some numbers that when I see it, I'm like, oh, you've had a stroke or you're about to have one.
But it's sad, right? People are having issues today. And there was something you said, when we had this conversation 2 days ago, that the things that happen to people ultimately come straight to the heart before they begin to dissipate through the body. Talk to us about that so that people can know how to take caution when they allow themselves to worry or be anxious.
Right. So I said earlier about bad stress, although it's just called stress. With the release of things like adrenaline and cortisol, the first thing is you need to. I once watched a video, and it was a calming video when a boy was about to go into a tantrum phase, and then they told him breathe, breathe, breathe 1, 2, 3, 4, 5, and then it calmed him down. And then he was throwing a tantrum because of the remote of the TV was seized from him. So that applies to us also when we have things that are traumatizing or you're in traffic. That's the first point. There's nothing you can do about the traffic. So breathe. Calm, take it easy, calm down. It's not very easy, but that's the starting point. You take it easy, breathe 1, 2, 3, 4, 5, because you are releasing an enzyme called cortisol to the body, and it is staying in your body, and it will damage your body.
What does it do?
It's like they're like steroids that should keep you on a high. And adrenaline is that stuff that allows you to jump over a fence when you see a lion. That is not supposed to be in your body long term.
Not normally, yes.
Yes, because it just stops blood flow and directs everything to one point and say you need this energy, this blood flow, this oxygen.
So when people get
jump.
angry without taking action,
Not good.
so man, my anger is bad. Man, you don't want me to. In fact, the moment I get angry like this,
I go kill person.
so let people. So that's what you're saying.
Yeah.
Essentially, just getting into negative moods has its impact
On the heart.
On the heart.
Well, and not
Among
only the
things.
heart, other conditions,
Other
trauma.
organs.
This is a digression. Trauma triggers cancer. So, some form of cancers also can intense grief and a lot of those negative vibes too. So we need to be cautious. But like I would always say, check. There are checks that can tell you your 10-year predisposition to heart disease, 5-year predisposition, 1-year predisposition. We could also check your markers and see what's going on.
Wait.
That.
I'm sorry. She just said something now that you can know in 5 years if you're gonna have.
Oh yeah, 1 year, 5 years, and 10-year predisposition.
People can know.
Yes.
What kind of test is that? Okay, that's trade secrets. Okay.
Now, I saw a video once when they said as you get older, the number of times you go to the bathroom in the night is not related to your kidney, but it's related to your heart. Can you please explain that to the layman, like myself?
So I saw that video also, but let me clarify.
Good.
For a man, the number of times you go to the bathroom in the night is related to your prostate. If the prostate is becoming enlarged, you would keep going, meaning that the tube, they call it tubal in our scientific
Lingo.
world. So the tube that is passing urine, there's a name for it. The prostate has grown, the tube passes through the prostate, and it's like that. So that means the muscles have pushed into the tubules and blocked it. And so the kidneys and all the tract, they are already still producing urine, but it's finding it difficult to come out. So once this lower part is full, you would feel like going, and then more trickles down, you feel like going. So you could go like 10 times. That's prostate enlargement. That's prostate adenoma. Adenoma, it's a kind of cancer, but it might be benign and it might be malignant, depending on the PSA that we see. That's the prostate-specific antigen. It's called a marker. A marker is what you use to know what's going on. So for a man, when you keep going like that, the first thing that comes to our head is, oh my goodness, this might be prostate enlargement. So we want to check for that.
Okay.
If it is a woman, the first thing that comes to our mind is either diabetes or your kidneys are producing so much fluid. That's it. If there's increased blood sugar, you're going to be going to the toilet, peeing. Frequent urination tests are all signals of diabetes.
why are you looking at me? I'm not a doctor. So there is nothing to fear. But you recommend.
Yeah, but get checked if that kind of thing happens.
So how frequently should anyone get checked for all these things, especially the heart disease, the heart health that you're talking about?
Well, now the norm is your figures expire after every 6 months. But for your heart, yeah. So scanning checks and all that should be done twice a year, minimum. Some do the full annual medicals once a year. But you know, once you see any signal that just worries you, get checked.
It's just a little worrisome, but okay. How about children? Because sometimes children produce some, should I say, signals that parents are at a loss. Especially, do children have such heart conditions that are worrying as well? And how will their parents know if there are no signs?
For children, I know that children that adverts come with holes and all that, children should always see a pediatrician straight. I mean, there's no need playing around. Once you see any funny condition, a child should regularly or normally not have high blood pressure. I mean, crying out loud.
Yeah.
You know, so but once you start noticing something funny, fainting, seizures, or a whole lot of things could be wrong, much more than heart health problems. So straight to the pediatrician, straight. No, just go.
And you know that sometimes children are seemingly more vulnerable to catching a cold at the whim.
Yeah, so like I always say, people would be like, oh, there's no need to supplement. And I have my focus is wellness, you know, so of course at the wellness center, all we do more is focus on nutrition, supplements, diets and all that stuff. So I always tell people that there is always the need to supplement because you're not getting everything from your nutrition. So, yeah, but then don't hit the road and like buy this, hit that. You always need this. I always say that there is a need for guided nutritional supplementation because you need to see someone who is qualified to guide you. Okay. So you're not running amok, like hitting everywhere. And at the end, and you know, some of those things come affordable. So, you know, very good result-oriented, result-backed supplements are not particularly
just on the shelves.
Yeah,
okay, we understand. Yes,
I get it.
I get it.
I get it.
Okay.
Yes.
We have to thank you very much this morning. Yonda Beniga is MD and Principal Consultant, Medi-Ideas Lifestyle and Wellness Center. Thank you again for your time today. And I guess we can safely say that that brings us to the end of Sunrise this morning. You're wondering, what happened to our home stretch? Well, the home has been stretched. It just so happens that our guest of the week, you know, got caught in traffic. That's unexpected, but hey. So, but most certainly next week we will have an artist of the week for you. For me, I say have a wonderful rest of your weekend. Bye for now.
And I say enjoy the rest of the weekend and the week ahead. I am Alero Edu.
And I'm Ayo Makinde.
Bye-bye.